Hi, and welcome to my first podcast where I speak to those involved in health and well-being and share some new stuff. Plus, I'll be asking questions that my clients and friends have asked me over the years. Today, I'm really pleased for my first podcast to introduce Dr. Susie Gronski, and she's a physical therapist specialising in pelvic health for the public, as we established last time. So tell us how pelvic floor and pelvic health and fanny farts all come together.
It's a wonderful introduction. I love it. Fanny farts. Who doesn't want to talk about fanny farts? I think the post was fanny pants and incontinence, like women's underwear and incontinence issues that some women deal with unnecessarily. So my post was more so geared towards that and making it aware, less taboo, that if you're pissing yourself when you're exercising, or laughing or coughing or sneezing or playing with your kids or on the trampoline, that's a bit of a problem. And there's help for it. Most importantly, yes, that's a problem. And number two, there's help for it. You don't have to be wearing pads for the rest of your life. I did a little review on a company called Fanny Pants.
Oh, right. Yeah, that's it. Yeah.
Yeah, they create incontinence type underwear and reusable pads for those that, suffer from incontinence. Whereas, I support a company like that because who wants to deal with, plastic pads and poise pads and those sort of things that have like bleach chemicals and all of that on them.
Oh, right.
It actually can irritate the bladder. But I also promote my profession, which I like to say I'm the physiotherapist for your privates.
Right.
But it's where women and men, could suffer incontinence with coughing, sneezing, laughing, jumping, exercise, playing with their children, jumping on the trampoline, and that's not normal, and there's help for that. There's strong evidence to support that pelvic floor physical therapy or physiotherapy helps with symptoms of incontinence, and you can live a incontinence-free or leaky-free life. So,
all right, that's really interesting actually, because you mentioned the trampoline, and that I've heard before. Some of my clients in the past have said no, they're going to definitely avoid joining the kids on the trampoline, otherwise they feel their guts are going to fall out. That sort of thing. But you say that's not normal, or is it just a? Well, to be honest with you, it's usually women that I've heard this from, usually having had children as well. So, is this something that you've found in your clinic, or?
It is very common. One, women have 3 holes, men 2, and they do, of course, deliver children. So the more children that you deliver, the more children that you have, it predisposes the pelvic floor to dysfunction or issues down there. Those pelvic floor muscles, when you're delivering, when you're having a child, not only, I should backtrack, not only when you're carrying the child, your uterus is growing and the belly gets bigger, and those muscles down there are overworked and underpaid. They're working 24 hours a day, 7 days a week to help sustain some of that pressure from above. That intra-abdominal pressure, that's their job.
Right.
So, you've got 9 months of that. In addition to hormones that are changing, you have ligament laxity. So you've got things like relaxin, which is a hormone that does that. It relaxes the ligaments and the muscles to help widen the pelvis to make room for the baby during delivery. So your pelvic bones become wider. Yeah. So things are loosey-goosey down there, and those muscles are really doing a tremendous amount of work to help stabilize the pelvis during pregnancy. And during delivery, if all goes well, the chances of having a risk of pelvic floor dysfunction is minimal, but, in reality, how often does that really happen? Where in an ideal world, nothing goes wrong, right?
Yeah, sure.
If you're pushing too hard for a long period of time, all that repetitive stress and strain down the pelvic floor can predispose you to dysfunction and injury. And also, if you're pushing really hard but really fast in a short amount of time, that can also predispose you to a dysfunction or injury. There are muscles down there, so you have things that some of the muscles may tear and fray away from the pelvic bone.
Right.
You've got so that happens. They are overstretched as the baby comes out. Those muscles are overstretched. I think it's 2 times the length of their original size.
Right.
So think of your bicep stretching twice its size.
Right. Oof. Where do we start? So just one of the things you said there about pushing too hard and for too long. So are you saying that a really long labor can really weaken these muscles, or do they bounce back? I remember I've certainly come into contact with clients sort of getting close to giving birth, and I've done yoga classes where it wasn't a yoga class, but it was an exercise class where relaxing meant that they were at risk, so I had to watch them pretty and limit them with what they were doing, and adapt the exercises for them. So the body bouncing back, and these pelvic floor muscles returning to normal. How soon should they return to normal after a standard pregnancy or standard delivery, shall we say?
That depends on the person. So,
right, okay.
So it's so hard to say that, in general practice, conventional medicine and standard of care the OBGYNs will say, oh, it's been 6 weeks. They do a little check and, oh, you're good to go. Go back to normal activity. I would have to beg to differ on that one. They're oftentimes told to return to exercise, maximum exercise. Now think about this. If somebody had surgery, right, or had a knee replacement or a hip replacement, would it be safe to say that after 6 weeks of healing that they should go back to their normal, everyday, full-blown exercise regimen, or after any type of muscle injury or something like that? I don't think so,
Sure.
So, why are doctors not picking up on the cues that they need to be rehabbed? Those muscles need to be rehabbed. They've been stressed and honestly traumatized from delivery, and ample recovery time depends on what's their diet like, what's their stress like at home. All those things impact their sleep deprivation. A lot of women are they're not sleeping. Their sleep cycles are disrupted because they have a child that they have to tend to, breastfeeding or feeding in general. The life changes when you have a child, especially for new moms and moms that are seasoned and have a newborn, in addition to 2 other children, So there's a whole complexity in analyzing, a person in terms of, what's going on biologically, what's going on mentally, psychologically.
Yeah, sure.
And what's going on socially in their environment, what support do they have, and how resilient a woman is during and after her pregnancy, and that depends on the support that she has and the strength that she thinks she has as well. So not only the musculoskeletal or the actual physical component of strength and resilience, but also the emotional and mental component as well.
Wow. Okay. We have strayed a little bit off track how I envisaged, but this is important because I've had many a client who really they've had a baby, they want to bounce back. There's no time for, the clock is ticking, they want to get my body back, They're going to feel that they can do as much as they can and push themselves really hard to get back to their former self with all these factors that you've mentioned, which makes it really difficult.
Right, or predisposes them to injury because
Exactly.
they are still, again, their hormones are trying to balance as well. And if they are breastfeeding still, they are still releasing prolactin and oxytocin, and those are all hormones that are contributing to soft tissue, changes as well in the body. So that also can predispose them to injury prematurely if they're going into things head on instead of a gradual kind of progression. To the opposite end of that, some women have pain after they deliver. I mean, their muscles might not be weak, but they might have an overactive or how you think of a Charlie horse or a spasm, where you got like a knot in your upper trap or something, a tight muscle. Those muscles down there could also be acting that way. And if you don't release the muscle and lengthen the muscle, the function of that muscle to help you or to strengthen would be counterintuitive at that point.
Right.
It's just adding to the problem. You're adding more fuel to the fire if you're not addressing the true component of what the dysfunction might be in that person's case. Right.
It sounds pretty much from what we've just been talking about that you probably work in close relationship with gynecologists.
I work closely with gynecologists, urogynecologists, those that deal with bladder dysfunction, with naturopathic doctors, integrative doctors. I typically get my referrals from word of mouth. One patient will tell another patient will tell another patient. But I know the pelvic floor community and the specialists, women's health specialists in general, they are very strong and they really do a good job all around the world of trying to educate practitioners, general practitioners, and also gynecologists, because you'd be surprised. It isn't standard of care to send a woman after 6 weeks postpartum to rehab or to pelvic floor physical therapy. It's not standard of care. Whereas France, I think Australia, and even in the UK, I'm not sure, but overseas, it's standard practice to send a referral to pelvic floor physiotherapy.
Okay.
Afterwards. Whereas in the States, sadly, that's not the case, and I see that day in and day out.
Okay, Susie. So perhaps it's best if you tell the listeners a little bit about physical therapy, because and your specialism, because I hadn't heard of physical therapy. I've heard of physiotherapy over here and physiotherapists. And what you do is very similar, or if not the same, I presume.
Yes, it is the same. Physiotherapy and physical therapy are technically the same. It's just a matter of the standard of education or the curriculum that you've taken in terms of what designation to use. I mean, I personally use both. Like, I like to say I'm a physiotherapist for your privates. It just sounds better. But the American Physical Therapy Association recognizes both under physical therapy. Overseas, like in the UK, Australia, and in Europe, they use physiotherapy as recognition for physiotherapists. In the States, it's physical therapists. Okay. So they're both the same, one and the same. The one distinction, though, is that our degree is a doctorate degree. Right. So we are allowed to call ourselves doctors of physical therapy.
I see.
Yeah.
But you also do this visceral manipulation we were talking about, and perhaps you'd enlighten a little bit more about that. What's involved there?
I love visceral work. So visceral manipulation is the act of not manipulating, I would say providing manual therapy, hands-on work to the myofascial system around organ structures. That could also include manipulation of the nerves, blood vessels, anywhere in the body that, from a protocol standpoint of doing this work, that you get pulled to. So I like to think about it as this analogy. Let's say you have a bowl, and you put saran wrap really tight over the top of that bowl. And you put your hand in the middle of that saran wrap on that bowl, and you feel its smoothness and its contour, right? The cellophane wrap or that saran wrap is nice and smooth. I tell you to close your eyes, and then I pinch the corner of that cellophane wrap. What you'll feel, or what you should feel, or what a visceral practitioner feels, is a line of pull or a line of tension. Your hand is going to be attracted to any area of restriction, adhesion, or tension that is most important for the body in that moment in time, in that day, whenever that person is presenting to you. So I'm physically finding areas of tension or restriction in the body that person's body is telling me to go to. And this takes lots of practice, obviously, to develop hands that can feel for those sensitivities and that detail.
That's a lot of practice.
Lots of practice, just like a wine connoisseur has to taste many, many wines, right?
Yes,
to develop
of course.
a palate. So that, and that's what I do. So I work inside, I call it the body mechanic or the organ mechanic, but essentially, scar tissue, inflammation and recurrent infections, the poor diet, stress, those are all distributed in the body and will manifest themselves in a physical way. And over time, these compensatory mechanisms will present themselves to a language of pain. The body is going to start telling you that, hey, you need to pay attention to me. Something has to change, whether that be pain signal, whether that be digestive issues, insomnia, poor metabolism of organs or whatnot. I mean, all of that, those systems work together and they communicate with one another. So why, in my opinion, why wouldn't you work those systems as well?
Sure.
You've got the musculoskeletal, you've got the organ systems, you also have the neuroendocrine, the hormone systems, all of those systems, they all communicate together. So
that's fascinating. How did you get into that in the first place? Is that part of physical therapy or?
It's not part of physical therapy. Actually, it's advanced training, pretty advanced training. I've been working with the Baral Institute in training for visceral work for the past 4.5 years. And how I got it started with them, or how I found out about visceral work, was my own personal experience with swallowing issues. So this was about 3 years ago, maybe 4 years ago. I'm sorry. It probably was 4 years ago. And all of a sudden, I started to have a hard time swallowing. And what would happen is I'd be out with my friends or my husband, and we'd go out for a meal, and I'd take my bite, I chew, I swallow, and I'd feel like my esophagus, my eating tube just clamps down on that food. So I would feel like I would be choking in the middle of my meal. And then I'd go into this whole vasovagal response where I start to sweat, the room is spinning, I try to get up, I'm beating my chest like King Kong. It's, I don't know what's happening to me. And so the first time it happened, I was scared shitless. I was very scared. I was, my husband's like, do you want me, do we need to call 911? My friends are looking at me. I mean, it was very bizarre. And I just thought I just swallowed a big, like you take a big gulp and it has a bunch of air in it, or too big of a swallow, right? We've all had that, where you're like, oh, it kind of was just too big. It didn't feel like that, because it felt like literally it took my breath away and I couldn't breathe. It felt like I was choking.
Right.
I would hiccup and it would go away. So it would be, for me, it felt like eternity, but it wasn't. It probably was, a minute. If anything.
Sure.
So I thought nothing of it, and it started to happening more and more and more often, to the point where I would literally not want to go out to eat. I isolated myself socially. I didn't want to go out because I was afraid that this was going to happen in public, and God forbid, what if I don't get help? And I'll just croak right there.
Susie, did you see anyone for it at this stage, or were you trying to self-diagnose?
I didn't. It was a year. At this point, it's been a year. At that point, it was a year already, and I didn't, because I tried to avoid hospitals and doctors. Oh my gosh, I know I'm terrible at saying that, but I'm very no, I don't want them sticking a tube down my throat, because essentially to check for, any dysfunction with swallowing, they'll have to do an endoscopy, where they kind of go in with a tube down your throat to assess for any constrictions or, tightness in the esophagus, because it's a muscle, of course. And I didn't want to do that, and I just let it kind of keep happening until the point where I was like, I don't know how I'm going to manage this anymore. I mean, I wasn't swallowing pills. I stopped taking vitamins. I was scared to swallow, because I thought it was going to be my time. And then, so I backtrack to the story. I got in touch with a pelvic floor therapist in the area to shadow her, and she did this work. And then I was like, this is very interesting. But I was a very big skeptic too. I was a skeptic where I'm like, give me the hard science. Who can feel an organ, really? And I went for my first class. I signed up. It was the first level class, and I decided to be a demo for the stomach. Out of all demos, to be the stomach was for me. So I sat up on the plinth table, and I'm sitting there, and I'm like, this is absolute BS. Like, I can't feel anything. He's not doing anything. He's just moving my skin around. And as I'm sitting there staring at the ceiling tile with 50 students looking at me, I start feeling this rush of blood going through my face, and my eyes start swelling, and I'm thinking to myself, oh my God, this is really going to happen. I'm going to cry in front of all these people. I'm going to cry. And I just started bawling, like hysterically crying, where I couldn't catch my breath, crying.
Whoa.
It was intense. Sean. It was like, what just happened to me? What did you do? Where am I at? How embarrassing. I kept apologizing. I'm so sorry. I don't know what's going on. I swear I'm not crazy. And, the instructor, Peter Coppola, is like, man, that couldn't have happened at a better time. And that's what a visceral emotional response would be. And I'm like, what? And so as I learned the curriculum, and as I was sold after that day.
Yeah, I'm not surprised.
I was sold, and I followed up with several sessions of visceral therapy, and I learned more about the vagus nerve, the nerve that is the rest and digest nerve that kind of regulates and kind of wanders through the body and facilitates this rest and digest kind of communication to all your organ systems, your heart, your lungs, your stomach, your esophagus, and that was very irritated on me. And granted, I was under a lot of stress at that time in my life.
Right.
Lots of stress, lots of anxiety. Changing careers, changing professions. Am I doing the right thing? And the stomach has a lot to do with, from the emotional aspect of how you present yourself to the world, but how you really view yourself, and career and professionalism. So it kind of made sense in that way. And of course, past regressions and childhood crap that happens that builds up over time. All of that stuff. Tissue memory, right? You've heard of tissue memory. The brain remembers, the body remembers.
Sure.
Memory, right?
In fact, I read a book by a really good book on the gut by Dr. Julia Enders, and she describes it as a second brain because of the seat of emotions, etc., etc. So I can pretty much agree with you there on that. Yeah, so much stems from there. Wow. And so since then, you were sold. You've been part of your practice now as well, is it?
Correct. Yeah, I use a lot of the visceral work in my practice, and I'm also an assistant for the institute. So I help others and the teachers, and I'm looking to become a teaching apprentice so that I can hopefully teach the work internationally, both nationally and internationally. So they do have classes that are all over the world. With this work, so.
Oh, that's fantastic. That must have been a scary time, though. And since then, you've not had any recurrence.
Knock on wood, as I knock on my desk right now. I have not had any episodes or attacks that I like to call them. Thank God. And that doesn't mean that I don't do any self-maintenance. Of course, I can tell when I'm feeling a little on that edgy side.
Yeah.
And I'll do my breathing and my yoga, and I'll be more mindful that day and drink plenty of water. And so there comes, you have to own ownership to your health, and it's a constant maintenance. It's never a straight line. It's always a loop-diddy-loop, going over mountains and hills and taking detours. You know how that goes.
Yeah, sure. All right, okay. Well, I've got a few more questions for you. I'm going to bring it round to everyday fitness. People who have read a little bit about fitness in a magazine, or they've done some work at the gym, or they've taken on a personal trainer. And we've already mentioned the whole pelvic floor and the tightening up the abs, etc. But if we go back to, we were talking about females and post-pregnancy, they're very often attracted to Pilates. And I've mentioned that group, but it's not, obviously Pilates isn't just for that group, but it really is renowned or as something that works for the pelvic floor. Now, is that something that you'd go and recommend your clients to do or patients to do? Or what are your thoughts on it, basically? What are your thoughts on Pilates? Do you do Pilates, perhaps?
I don't do Pilates myself, but that's not to say that I wouldn't recommend it for others. it goes back to understanding the function of the pelvic floor, and if the person that is, or the woman that is taking Pilates has any other symptoms or risk factors that might not be conducive to her participating in an aggressive Pilates program. Now, for the lay person, typically they're in classes, right? So there isn't that one-on-one attention. And it also depends on the instructor and their knowledge of, their knowledge just beyond like, okay, use your transverse abdominis and pull up your pelvic floor,
Yeah, sure.
Because most women, when you tell them that, 75% of the time they don't know what that feels like. They don't know what it feels like to contract their pelvic floor.
Sure.
So, they might be doing, again, themselves a disservice. Now, Pilates also focuses aggressively on the abs, which you talked about. You mentioned the abs. When you're doing Pilates moves, from my understanding, it increases a lot of the pressure within the abdomen, right? So you're doing a lot of like a crunch, and you're adding some sort of dynamic movement. So you're increasing the intra-abdominal pressure within the system. Now, what happens to the pelvic floor when that happens? Repetitively. Pelvic floor muscles guard. They protect. They'll start to tense to oppose the pressure from above. Again, that's their job. They make sure your organs don't fall out. They make sure everything stays up there.
Yeah.
They keep you continent. However, over time, it may predispose the woman to fatiguing of these muscles, over-recruiting these muscles inefficiently, holding their breath and bearing down. Oftentimes, like when we're doing sit-ups or crunches, you've probably seen this yourself, where people are holding their breath and they're doing a bunch of them. And then you get a hernia.
Sure.
Or, you hurt yourself. Again, that pressure has to be dispersed somewhere, and it's typically going down south. Right. So if a woman has had a baby recently, or they've had a hysterectomy, for example, where the uterus was removed for whatever reason that may be, the buffer of that organ is no longer there for a hysterectomy.
Sure.
In pregnancy, they just have, they've had postpartum, their muscles are still recovering. Again, they're weak. They need to be rehabbed progressively. And if you add a repetitive intra-abdominal pressure repetitively, that can predispose you to more injury and more harm. For example, very common is pelvic organ prolapse, where it feels like your guts are falling out. Like there's pressure down there, like something is coming out, then that's a problem. And in that case, I definitely wouldn't recommend Pilates, or I would say definitely seek a physiotherapy therapist who can evaluate you efficiently, and then go from there to see what plans might be better for you. I'm not saying that you'll never go back to Pilates, but if you understand a little bit more of how your body works down there, you might be more better off applying some of those same techniques when you are doing some higher level activities such as Pilates.
So I think from what you're saying is an instructor that knows what they're doing and can deliver a good quality one-to-one. And also if the person attempting Pilates, as long as they haven't got any significant issues, then they're fairly progressive, then they should be fine. Also, come to think of it, Pilates isn't just for, obviously, it's favoured by females, but if done correctly, it can really help the lower back. I've known a few guys go along with, say, herniated L5 or something, and they need to do something to strengthen they've been told to strengthen their core, and their doctor will say do yoga or do Pilates, and they may therefore be told that they've got a weak pelvic floor. Is that, again, I know this is very much someone walking off the street into an exercise class. Is it too generic? Are you still thinking that one-to-one is always better?
In that instance that you described, like for somebody that's saying that they have a weak pelvic floor or they've got low back pain, in general, any type of exercise is going to make you feel better.
Yeah,
it doesn't matter what exercise, just get up and move is the prescription. But I am a big fan of having one-on-one, especially just initially, just so you can get the hang of things. And there are Pilates instructors that are specifically trained within pelvic floor as well, like low back, pelvic floor, hips, they're all connected, so you can't really separate all of them. But they can modify certain activities for you individually based to your unique needs or interest at that time. So,
Okay.
so that's what you can get with a one-on-one person for, let's say, the first phase of your training. And then once you feel confident enough to apply some of those same techniques to a group setting, then you're more likely to be more compliant and less, have less of a risk for injury than not having that guidance, I think.
Yeah, you're right. I guess it's shopping around. There's going to be good providers, good instructors. In fact, from memory, there are a lot of physios over here deliver Pilates classes, actually, but those groups are very small, and I, understandably so. From Pilates to yoga, talk a little bit about the poses and there's lots of legs wide apart sort of thing, the hip openers. I just wondered what your experience or observations are on yoga with that kind of stance and holding in those sort of positions, how that affects down below.
That's a great question. I am a huge fan of yoga for pelvic floor issues, especially pain. Those positions that you talked about, those leg wide opening positions, help lengthen the pelvic floor and stretch. So like Malasana or the yogi squat, where you go down really deep and your feet are flat and you're kind of like in between your knees in a squat. That's what I use to tell my patients or clients to do while belly breathing and relaxing. So that area between your sit bones, that bony part that you sit on, that bony part of your butt, that whole area in between that's the pelvic floor. So when you're in that position and you're breathing, it helps lengthen the pelvic floor even more for like a relaxation. Anything that helps to open up the hips, hip rotations, adductor stretching, when you're doing that, supine or standing or anything like a wide straddle stance. As long as you're paying attention to relaxing the muscles around those areas, around the pelvic floor and the hips and the backs, that will be very beneficial to relaxing the pelvic floor as well, because you're using the breath to also facilitate relaxation.
I see. If I backtrack just a little bit, so to summarize, the pelvic floor, I just remember a few years ago, it was very fashionable here in the UK to just focus on abs and pelvic floor to make it really strong, etc., etc. From what you've said, certainly with even Pilates and in general fitness classes, it's not all about overworking the pelvic floor. And say something like yoga, you're just mentioning about as long as you're relaxing while in the certain pose. So yoga is up there, but what would you say are your favorite exercises for the pelvic floor?
Is it in terms of strengthening or?
In general, for pelvic floor health, for strengthening as in if they're weak and they need to be working at optimum function, as opposed to strengthening as in like hypertrophy, going the opposite direction, which is therefore overworking from what I've understood you to say. So.
Right. Yeah. So when you're working really, really hard, so like, when you mentioned the abs and the core working out and doing the pelvic floor exercises and, not to digress, but there's a woman that actually does vaginal weightlifting. I kid you not. There is a woman that will lift some dumbbells with her vagina.
You're joking.
That's a little overkill. No, I'm not. If you type it in, type in vaginal weightlifting or vaginal weightlifter.
I'm not sure I'm going to be able to type that in really on my search engine, to be honest with you.
But for your listeners, if they're curious, like, what? It is out there. I think it's a little overkill in that sense.
Right.
In general, those muscles are working anyway to sustain continence, for stability, and for support throughout the day.
Yeah.
So overworking them or trying to work them without cause, I think could maybe potentially do more harm than good. Again, not knowing if those muscles are overly tight or tense. For example, I always like to use the biceps analogy, but if you have a tight bicep and you're always walking around with like, a Popeye muscle popping out kind of thing, you're always contracting your bicep.
Yeah.
And you, at the end of the day, you want to go, let's say lift some weights, but you've been contracting this muscle all day. I don't know how efficient or how much weight you're going to be able to lift at all if you can't even stretch it to get it to lift the weight. You see what I'm saying? So
Sure.
you have to have enough or sufficient muscle length and relaxation in order to get a very strong and efficient contraction. So it has to work both ways. You have to relax the muscle and you have to contract the muscle. You can't just keep it contracted and walk around like many people think that they should be sucking in their abdomen all day, sucking it.
Exactly. Which you'd pick up a magazine, it would say, oh, while you're at the bus stop, be holding in and your transverse abdominis. While you're washing the dishes, be sucking in from your anus, etc., and pulling everything in tight. But I guess these are introduction exercises for those with incontinence, or not, perhaps.
Because you can have incontinence, but you can have shortened muscles as well. So tight, spastic muscles or overly tight and tense muscles can also be weak.
Right.
You can also have the opposite, where they're loosey-goosey muscles. I oftentimes see the opposite. I oftentimes see an over-recruited pelvic floor where I have to downtrain so that those muscles efficiently learn to coordinate with functional activities such as laughing, jumping, coughing, sneezing to prevent incontinence. Because if it's short already and you go to cough, there's no more give.
Wow. It's a bit of an education, actually, for me. Thank you, Susie. It's.
I wish it was much easier. I know that this is just like in a nutshell, but I think just being aware, and I think that if the listeners and other health providers are aware that these muscles do a whole heck of a lot, and there could be opposite issues going on, not just always a weakness, an issue when you're having incontinence type symptoms.
Okay. I do want to stick with that point, but before I forget, just exactly how do you do vaginal weightlifting? I'm just...
So I think she inserts a cone a cone into the vagina. So a little tiny cone that's, a kilogram in weight or something. And or not kilo. Wait, that's 2 pounds. Never mind. It's very small, minuscule.
Okay, right.
It's like little, just a little probe, what have you, like something that shows, like a tampon almost.
Oh,
right?
Okay, right.
But like made out of something obviously more heavier than a tampon.
Sure.
Right. So insert a string at the end of that and have a weight hanging out at the bottom.
Oh my goodness.
If you Google it, they describe the way she does it.
Wow.
That's not to say that us therapists don't use vaginal weights. I mean, but they're very, 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 very tiny in terms of actual strengthening, or even for feedback, like squeeze around this and let go, just so you can get a sense of what you're doing.
Okay. Yeah. Right, I've never come across that. Okay, right. Let's pause there because I've lost my train of thought for a second. Okay, yeah. So at the other end of the spectrum, so to speak, we did talk about athletes, and I've heard you say that even they can suffer from leaky bottoms, leaky bladders, some form of incontinence. Is this something entirely different, or is it again still related to too much pressure going on with the pelvic floor?
You're right on. It's that. It's too much pressure, overworked, high stress. Athletes that are under pressure performing are tense, right? They have stress, they have anxiety, depending on the age group and depending if it's a man, or actually more women actually have this, not men who are athletes, but women, what part of puberty are they at? What's their menstrual cycle like? What are their hormones? A lot of them do have dysregular periods or they don't even have a period, and that can predispose them to a whole slew of things that we won't get into, but those all impact the tissue health, muscle tissue health in general, and we're dealing with muscle, skeletal muscle, so they're going to be impacted in the same way. So for them, oftentimes, in my opinion, it's an over-recruitment of those muscles, too much working and not relaxing. And how often are they really paying attention to, well, what is my pelvic floor doing? Sure. They're most people are not even aware 99% of the time of what these muscles are. And for a reason, obviously, social stigma and taboos and cultural taboos or religious views, some of that gets numbed or out of the equation.
That whole area is going to be significantly worked with weightlifting, especially heavy weights. If we stick with weights first, I was going to ask you about running. I was going to presume that running is, as long as there's no significant issues, is going to be a simpler way of strengthening holistically the whole body, really, all the way up. But let's stick with weights, actually. I'm well aware. Oh yeah, I introduced you to the straining that can predispose people to hemorrhoids, or known as Farmer Giles.
Farmer Giles. Oh my gosh! Yes, when you told me that, I was like, Farmer Giles. I love that term.
A little bit of rhyming slang there, rhyming for piles. But no, seriously though, that pushing too much on the squat rack, on the leg press, or just lifting too heavy, what's your take on that? Or do you have many casualties walk through into your surgery? What's the score there?
Oh, hemorrhoids. So where do I begin? No, in general, yes. Heavy lifting, what's causing that is not the heavy lifting per se, but their mechanics of holding their breath.
Right. Yeah.
They're doing a Valsalva, which is a holding of breath with overexertion. So you're bearing down and you're pushing and you're plowing through it. And again, pressure moves in the direction of the least resistance, and you have holes down there. So everything's going to want to go down there.
Yeah.
And ultimately, that creates an abnormal pressure system, and there's a lot of vasculature that is surrounded by the anus and the anal canal, in general, the pelvic organs, and your gut, as we talked about.
Yeah.
But you can have a prolapsed vein. Essentially, that's what a hemorrhoid is a vein that's prolapsed or popped out due to pressure.
Sure. Due to pressure,
poor pressure. And that, again, lots of things can contribute to that. What are your breathing mechanics? Posture? Are you sitting for prolonged sitting? Yeah, sitting for a long time. Now, in our age now, everything's electronic and lots of desk jobs and stuff like that. And evolutionarily, we're not creatures to be sitting and stagnant in one space for a prolonged period of time. We're meant to be running and walking and gathering our food and running away from predators, So that also changes the way our body is functioning. And not to mention constipation is a huge one for hemorrhoids. Huge.
Yeah.
If you're constipated, what do you tend to do when you're on the toilet? You're hulking it until you're green to get that turned out,
Yeah, sure.
You're like, okay, let's do it. And it's that type of pressure and that repetitive. It's not just once or twice. I mean, I don't want your listeners to get the idea that, if I hold my breath, the world's going to end, I'm going to have a hemorrhoid or my organs are going to fall out. No, it's over time. It's chronic. It's repetitive stress and strain. And that can do a number on you and the hemorrhoids.
Actually, let's tail that back to something you said, which is pivotal. It's really important. The desk jobs, the sitting for practically 8 hours of the day. Okay, yeah, sure, you'll get up for lunch, etc. But sat at a desk for a long period of time. Do you find a lot of your do you have a lot of clients coming from that background? I've just gone and talked about athletes and before that we were looking at pregnant women who have just given birth, etc., and issues there, and maybe incontinence. But what about just the average Joe who may have a 9-to-5, sat at a desk all day? Anything that comes out, or anything that they can do?
Well, yeah, I do get a lot of the average Joes that do have hemorrhoids and have constipation-related issues, but they might not even know about it early on as well. And a lot of these average Joes have had a history of constipation as a kid too.
Right.
So this stems from, how early were they potty trained? What is their diet like?
Right.
What is their fluid intake like? The best advice I can give is really take breaks. I think there's a research article that says for every 52 minutes worked, you should take a 17-minute break, and that will increase your productivity and efficiency at work.
Wow, right.
So, taking frequent breaks, going out for a walk, don't eat your lunch at the desk, go somewhere, take a deep, breathe throughout the day, recognizing that, and when you're at work, I know this might be like the scariest thing for someone, but going to the bathroom when you're at work, like doing number 2, it's like unheard of at work, but if you gotta go, you gotta go. And the more you suppress that urge, the more likely you're going to have constipation related issues, because you're offsetting that urge way too many times, and that's a reflex, and that's going to become a habit.
Right.
So, eating a high fibrous diet, plenty of fluids,
etc.
And the way you sit on the toilet makes a difference too. So, giving the colon actually has to. It's funny that we're made that way, but the colon has to kind of have like a 90-degree bend in it to keep you continent, obviously, when you're standing up. And the muscles, the pelvic floor muscles, actually sling around the rectum to keep you continent when you're standing and erect. When we're sitting on toilets, and today toilets are made, so tall because they're comfort seat toilets. Everything's really tall. Go big or go home. And you're sitting more erect. Well, what happens is now those muscles aren't really being put on slack, or they're not relaxing enough, so that angle that the poop has to go through it's not straight anymore. Now it's got that bend in it, so it's really hard to kind of push things through with a kink. Like, think about a kink in a water hose, right?
Yeah.
If you kink it, the water pressure is going to be a lot low, almost nothing.
I have heard about this actually, and certainly on the continent. So I think the French have, and in Europe, there's a lot of standing loos as opposed to the toilet seat, the standard toilet seat that we have. And what I'm really mentioning is that angle that you mention is the incorrect angle. We should either be kind of have our feet on top of the seat as well and be slightly tilted back. So I have heard that, but it's interesting what you said about that for, as I say, average Joe, but office worker, the everyday person. But I was thinking more of just the 8 hours, not just the effect on constipation and hemorrhoids, but just on on pelvic health in general. Are there any other issues that folk need to consider, or is it pretty much just get up and keep moving, and as simple as make sure you don't hold it all in, and make sure you go when you need to go?
Yes, I would say so. I mean, when you're sitting, functionally, you're on your sit bones. If you're in correct posture, the pelvic floor muscles should stretch. So from one sit bone to one sit bone, when you sit, those pelvic muscles stretch. Now, again, if you're having, you're not liking your boss at work, you're high strung, you've got lots of anxiety, you're working on projects, lots of pressure. What happens to your body when you're in anxiety or stress in that type of mode? You're in fight or flight, and what happens to your muscles? We've all been there. They tense up.
Yeah.
And you're crouched, and your posture gets, you're slumping forward, you're knee deep in your laptop. And so posturally, your whole body's affected, and that's affecting fluid flow, lymphatic flow. And also there's this bioenergetic component as well, like, when your sternum and your whole body is in this like slouched posture, it tends to affect your mood. It's like this guarded, angry posture almost, because when you're happy, you're not slumped over, hunched over like Quasimodo, right? Your shoulders are broad, you're tall, you're sitting up taller, you're using, you're open. So I think of it dynamically like that. I think in general, sitting for 8 hours straight or not getting any exercise in your day at all, it will predispose you not only to pelvic floor dysfunction, but to a whole other slew of things like cardiovascular disease, So it's living a sedentary lifestyle, which I think sedentary in general is just sitting and not moving and doing anything, is going to create dysfunction in your body.
Okay. There's so many different sports and exercises I was going to ask you, but one that springs to mind is regular swimming. That's another whole body, low impact exercise, and actually it leads me into infection and changing of pH, because I like to use the jacuzzi a lot. I like to use the steam room a lot, and I did read that there's a possibility of bacterial infection if with the change in pH, this, that, and the other. What's any experience with that, or?
Yeah, well, bacteria like warm, moist places. So anywhere they can hide out is a party for them. But in the short term, I think that's okay. To be in those obviously jacuzzi and a sauna and a steam room and pools. But if you're going to be wearing your clothes especially for women, if you're wearing them for a prolonged period of time and they're wet, that can alter the pH of the vagina. And I think that the normal pH of the vagina should be anywhere from 3.5 to 4.5, I think. So, the pool has its own bacteria, the chlorine, the chemicals, depending on where you're at, that could potentially be a breeding ground for bacteria that's in your suit, and it contacts the skin. So there's a possibility of that altering your normal pH, and especially if you're a woman and you're prone to getting frequent urinary tract infections or yeast infections or bacterial infections in general.
Wow.
That's one of the things I would say to avoid entirely. And when you're working out too, sweating, all of that it just stays there. Yeah. So you don't want an over colonization of that bacteria. Anyway, so right. Just smart, common sense hygiene. When you're done, take off the wet clothes, put on some fresh cotton underwear, or no underwear, whatever you want to do. It's fine with me.
Freestyle it. Now, basically, good hygiene, really. Okay. But if I scroll back to talking about swimming again, that gets the thumbs up for strengthening that area. Would that again be in one of your top?
I love swimming. Yep, Swimming is great. Yeah, the temperature of the water, the activity. It's a whole body activity. Works your cardiovascular system, muscular system, flexibility. You can do so much in the pool. Okay. So, yeah. So
we've identified yoga and say swimming as good for pelvic health. Yeah, pelvic health. I'm tempted not to say pelvic strength anymore, given but keep working at its optimum. All right, so we mentioned some ailments there. Let's stick with that. And I know you've covered this stuff, like endometriosis, in one of your newsletters, and that also caught my eye because my sister has struggled for years with it. I don't think not everyone's heard of it. Perhaps you might be able to shed a bit more light on your experience with endometriosis.
Sure. So endometriosis is a condition where the tissue of the uterus, inside the uterus, proliferates or goes to other parts of the body and doesn't stay within the uterus. So the problem with that is these endometrial tissues, when you have your period, those tissues also bleed. I've had some women that had them around their liver, around their stomach, and their intestines. So you can see how that could wreak havoc for a woman during their menses. That creates adhesions, inflammation, recurring, every cycle. And a lot of pelvic pain, bloating, the endobelly is complained about a lot. So that's endometriosis. And there's also a condition called adenomyosis, where the endometrial lining is these endometrial tissues are stuck within the wall of the uterus or the muscle of the uterus itself. So it's for both, they're not an ideal situation, obviously, and they can create a lot of pain. there's a lot of theories behind endometriosis, and none have been proven. It's one of these conditions that they're still looking to see what is causing it, or if there's any genetic factors or anything like that. But one that I'm interested in learning more about actually is this concept of reverse menstruation, where there's in a nutshell, what they're saying is that between the ovary, the fallopian tube and the ovary, there's a little space that opens up into the abdominal cavity, or it's like a portal, a little tunnel that has communication between the pelvic cavity and the abdominal cavity. And that's what they're saying that might cause these endometrial tissues to migrate out of. That's how they end up in the abdomen. Again, not proven, but for me, kind of makes sense being a visceral practitioner and anatomy. That makes sense to me.
Right. Ladies hitting menopause, a large client group for you, I'd imagine, and any reassurance for those having a rough time that you might be able to help with?
Menopause, I see a lot of patients with pelvic pain. So menopause, although some with menopause also have pelvic pain, I don't see many women that are menopausal. However, I have treated a good few in my practice. And typically what I see is vaginal dryness and pain with intercourse.
Right.
The tissue, because the lack of estrogen and the hormone imbalance is impacting the health of the vaginal tissues themselves. So they end up becoming atrophied and sensitive and maybe a bit frail. So intercourse could be it's not too common, but it can be a concern for some women in menopause.
Okay. Also, another topic that you could say I draw a blank on is hysterectomies, hernias. Hernias, I do know a little bit more about those, but those two groups of people, these walking wounded, I take it they come into the clinic as well?
They do. Hysterectomies is when they surgically remove the uterus. So for whatever reason, I know they're not doing it as common now. They used to do that just, from pelvic pain, thinking it would eliminate pain, and for abnormal bleeding, which is silly in what I think is silly actually. But they're not doing that as often now, unless it's life-threatening, I would hope. But there's always horror stories that you hear. The pelvic floor, of course, any type of surgical intervention, so hysterectomy, whether that they do it intravaginally or through the abdomen or suprapubically, right above the pubic bone, you want to work your scar, rehab the muscles, prevention, obviously not holding your breath because you don't have that buffer of the uterus, like we mentioned earlier. Yeah. So you definitely want to do weightlifting restrictions and just, again, an overall rehab of the new you now with after the surgery.
Okay. Actually, let's talk food if possible. I know that everything impacts on one system, as you mentioned earlier, and nutrition so important. Is it all about just drinking more water? And having more fibre, from your point of view? I mean, I know there's more to it, but what's your take on it?
Well, it's a little out of my scope of practice, a little bit. I mean, as a health and wellness coach and pelvic floor specialist, I do know some things about that. Diet fads in general, for me, I don't recommend them. It's basically eat real food, lay off of the processed sugars. Things that come in a box.
Sure.
Fast food. The ketone diet, I've read, there has been literature to support that it can help with infertility or fertility in men. So, when it comes to strong swimmers, a ketone diet might be really good. A Mediterranean diet is actually also very good when it comes to persistent pain, and also cardiovascular health in general. So, lots of veggies, whole grains, not a lot of the starchy white stuff, white breads and all of that, and soda. Limit your sugar intake, as it's pro-inflammatory. Sugar creates inflammation in the body and does a number on all of your systems. So, I'm a definite fan of just keeping it simple, keeping it real, go back to the basics. Yeah.
Well, another reason of mentioning that, have you had any, shall we say, casualties from experimenting with these diets and it really playing havoc with, with their poo? Yeah, any issues there?
I would say the most common would be a high protein diet, because really, really high protein diet might make it hard to go. Right. And it's really hard for your gallbladder and your liver to process really high protein. Usually, even though it's good fat, it's healthy fat. That's hard to process, I think.
Sure.
So that might be hard. Or if they're not breaking down their protein or their fats appropriately, they'll have floaters, like floating poop.
Yeah. Right.
Yeah, which is not typically a good sign.
Right. Okay.
But that, to the extent of my knowledge, that's all I know. Nothing catastrophic.
So no significant bladder. It doesn't go towards the incontinence or the bladder issues or urinary tract issues that you've found. You've not managed to make or had. What I'm trying to say is you've not had anyone come through the door who've ruined their body by following these regimes to an extreme.
Not particularly. There are some foods that might irritate the bladder, like caffeine, spicy foods, tomatoes, again, sugar. All of those things and alcohol certainly creates a more irritating environment for the bladder and the urethra, and also your colon, your digestive system. In terms of urinary urgency and frequency, incontinence, certainly foods can play a role in terms of what the functioning of these organs are, and what you're eliminating. So that's what I commonly see.
Okay. Which probably leads us on to sex then. Talking a little bit more about, or actually get started on that.
What's that song? Let's talk about sex.
I can't remember who was that? That was Salt and Pepper. That's it. Yeah. Salt and Pepper. No, I was going to ask more about food, but it's pretty much. It sounds like just eating eating sensibly, eating clean, or not necessarily using that buzzword of clean eating, but green eating, natural,
eat
real food.
Yeah,
that's fair enough. But before sex, just farting. We've mentioned fanny farts right at the start, but just general, flatulence and. We've got to look at the colon. So any, I
wish my husband were here. No, I'm just kidding. Talk about flatulence.
I did hear one of your podcasts with the guys we mentioned earlier. I forget their guys. That you do an inspection by placing your finger up the rectum.
Yep, up their bum. Yes, yep. That's how you palpate those muscles for men, for the pelvic floor muscles, and how well those muscles are functioning. Because we talked earlier, those muscles they not only keep you continent, but they also aid in defecation. So when you're pooping, if you're not relaxing your muscles down there, or you might be reflexively tightening, it's going to make pooping really hard. So that's why I inspect and also take care of any trigger points or tender points, especially in cases of persistent pelvic pain. But yeah, it's knowing how these muscles coordinate and function. But flatulence, it's totally normal. If they're really smelly, it might be with your diet. That's not typically common. You can have lots of gas, but it shouldn't be really, really smelly, like someone just set off stink bomb, constantly. Granted, that changes what you're eating, right, and drinking. But typically, better. That's what Shrek said, so.
Hold on. We're breaking up a little bit. Hold on. Okay, Susie, sex. It brings us seamlessly back to fanny farts. What are they? What is it? Just post-work, shall we say, expressive fanny? Or what's the deal with those? What should be going on? What do I need to know about fanny farts?
Are we talking about farts in general?
Oh, that was my tenuous link from from trumping, so to speak, or natural gas from one side to fanny farts.
Love it.
But
It's
yeah,
totally good.
yeah.
Farting is healthy, and I think I mentioned that Shrek once said better out than in, but onions, garlic, certain foods can make you a little bit gassy or more bloated, and that varies from person to person, honestly.
Hold on, we're talking about fanny farts here now, as in garlic and.
Maybe I'm misunderstanding the question.
Right. Back to fanny farts, which I think we've established that fanny means one thing here as opposed to in the States.
When I think fanny, I think of your derriere, your butt.
Oh, right. Okie dokie. But maybe you can shed some light on air that comes from the front as opposed to the back.
Vaginal fart.
Yeah.
Or a queef. It's called, in the States we call it a queef.
Oh,
but
that sounds much nicer, I suppose. It's normal. It could be normal. It's probably annoying more than anything for some women. It doesn't always happen. During sex is completely normal. You obviously have air that's being pushed up a hole. Yeah.
So it's normal for it to come out. So it's completely normal. And when you're exercising or during yoga, if it happens, I've had some women, very rare, complain about it happening during a certain yoga pose. It makes me wonder if they're tightening and just sucking up air and then releasing as they're relaxing into the pose. So I kind of go into strategies of how to coordinate their pelvic floor so that doesn't happen, especially in yoga. I mean, how embarrassing would that be? Everything's so quiet and dead, and all of a sudden you hear, a fart that's not really a fart. Quote unquote.
Yeah, sure. Okay. All right, if we stick with that area, then I'm also conscious I haven't really, if I backtrack, guys and pelvic floor, guys and pelvic health, 3 things that you'd recommend they need to consider. Just look after themselves, or certainly more than that.
The number one thing I'd say, if there's anything that is out of the ordinary or weird, not to be shy or ashamed to talk about it or get help for it.
Right.
Especially when you're dealing with erectile dysfunction, premature ejaculation, or pain in general.
Yeah.
I think that anxiety will play a big role in terms of men and pelvic floor dysfunction. In fact, that's what my new website and my new niche is going towards, is men and pelvic floor dysfunction. But don't be afraid to ask for help. It's not such a taboo topic. We can nip it in the butt literally the sooner that you get the quality care that you need. And when you do have pain down there, it's not abnormal to have sexual dysfunction with it, meaning your erection's not as strong as it was, libido is kind of down. Those sorts of things also come with any type of pain down there.
Sure.
Naturally.
Stress, and then the more stress, and then it compounds, etc., etc. Okay. Right. So that for guys, those are the top tips. Certainly don't ignore it. Go and seek help and speak to someone such as yourself. Okay. All right then. Well, sticking with sex, are there any recommended positions then that, or what would you suggest?
I'd say whatever floats your boat. Honestly, be creative. If you want to be creative, by all means, go for it. I've heard. I'm pretty sure not everything, but I've heard a lot of things, and as long as it's pain-free and you both are safe, and I don't see why not. So explore away, and that definitely depends on a person-to-person basis. Now, if a woman has pelvic pain or you've had a hip replacement, well then you'll have some expert advice or specialist helping you in terms of, well, honestly, and this might be digress, but there was an open MRI study done in Europe that assessed couples having sex
Right.
in various positions, and what those positions stimulated or what those positions helped to diminish. Or, for example, I've got pelvic pain, or I just had a hip replacement. This and this position is good. So they've got a handout, yes, that I typically give to my clients if they have something that is limiting them from sexual function, so we can get them back to sexual function without recreating symptoms. So there is a handout that does give you sexual positions, but more for a therapeutic standpoint. Now, if you're talking about the average Joe and they're just exploring and being frisky and having fun, well, then whatever position floats your boat.
Sure.
I think there's a 365 positions in every way, every day book. By all means, go for it.
Fair enough. But walking through your clinic door, I take it you must see you're dealing with sexual dysfunction daily, or not?
Daily, yes.
Okay.
Daily, yeah.
And what are the issues there, or what are the common issues, perhaps?
Common issues for women would be pain during or after intercourse, or both.
Okay.
Libido, so stimulation would be low libido, and for men it would be pelvic pain, so tip of the penis pain, prostate pain, or pain in their pelvis or between their sit bones. They also can have groin pain. I get a lot of men that have groin pain that is referred from the pelvic floor.
Wow. Okay.
So that's what I commonly see in the clinic.
Wow.
Pain.
Oh, they must be thankful for you relieving them of their pain, no doubt. Okay, what about, I've got some quick fire questions here, like what about toys and like the legendary rabbit, apparently. Not that I've used one, but...
Share your experiences, John.
Useful for keeping things going and the flues clear, so to speak.
Absolutely. In general, orgasm is good. Whether it's clitoral or vaginal, orgasm is good. So it flushes out. It's a sump pump down there. Flush out the cobwebs, keeps things kind of functioning. Sex in general helps to maintain good, optimal function of the pelvic floor.
Right.
Again, if everything's working right and feeling right. And using toys is certainly more than welcome to explore one's sexuality. And if women are having difficulty sustain or getting an orgasm, I would definitely recommend getting toys to assist with that and creating more intimacy and fun in the bedroom for that. On a more side note here, I did get my very first water slide. There is a toy that attaches to your tub faucet for women. It's just a little like a extender for your faucet in the tub that angles just right to hit your private area. I haven't used it yet. It just arrived today, but it's called the Water Slide, SLYDE.
Okay.
And it's something new that was brought to my attention actually through Instagram. Somebody reached out to me and asked if I wanted to try out their product. I said, sure, why not?
So we're talking a brand new product here.
Yes, I've never heard of it. Yes, but it's just using water, and it's great for hygiene too. Just water.
Yeah.
Extender, and you're having fun at the same time. So.
Excellent. Well, remember where I heard it first. Wow. I take it you encounter those who have perhaps been too vigorous with anal sex, I'd imagine. Or just vigorous in general. Are there any horror stories or?
They're in general, anything that's too rigorous, that doesn't feel good in the bedroom, or it's maybe at times it's uncomfortable, but you keep going kind of thing, that can create some problems. Those muscles will react. Again, if anyone's going to come up to you and try to hit you with a bat, what are you going to do? You're going to guard down, scour, and protect yourself.
Yeah.
The same thing with these muscles. They're going to clamp, they're going to tense, and then it becomes more of this learned habit. Tension in the pelvic floor. And the more tension you have, the more stress and strain you're going to have through there. It's going to affect the organs, the blood vessels, the nerves. So it depends. Not any specific trauma other than having objects stuck up the rectum or in the colon because, well, they wanted to experiment and they had to get that surgically. I mean, they had to go to the ER, obviously. But I've seen images of eggplant. I kid you not, eggplants, cucumbers. Food has been very, on a top list to play with, I guess. So.
Oh my God. It must be rather entertaining. I mean, obviously we're focusing on the...
Don't love it.
I mean, obviously we're focusing on the physical, and there's more to sex than just rutting like warthogs,
right.
Play, loving intimacy. You must have experienced and heard many stories, any tales of reassurance or tales of precaution?
I would say number one is open communication and feeling safe with touch, depending on what background that person is coming from. You don't know if there has been a trauma or sexual abuse or emotional abuse. So if you need help in that area in terms of reconnecting, and even if you've had pelvic pain, that oftentimes impacts relationships. I think sexual therapist or a psychologist that works with persons who have pelvic pain or dysfunction is a good thing to seek out. And I oftentimes do that and refer out many of my clients to get help with the psychosexual aspect of things, because that's very important. You have to, and again, it's not only just wham, bam, thank you, ma'am, in terms of activity, but how to feel safe and how to explore without feeling in danger and actually enjoying yourself, because it's a physiological function to have pleasure and have sex and be able to experience that as everyone's right. So
okay, right, okay, well, last little bit on that then. I've literally got a couple more questions left for the guys. I think you've covered it, but I've written down here, any tips for the Mr. Bean? Nothing wrong with Mr. Bean, but any tips for? You heard of Mr. Bean?
Yes, I love Mr. Bean.
Okay.
I used to watch him all the time.
Well, any tips for premature ejaculation? We've heard of Sting and his tantric marathons, etc. Viagra, is this something for the likes of Mr. Bean? And well, yeah, I'm mixing it all up here. Let's start with Mr. Bean. He's our man. Premature ejaculation. Doctor, how can you help me?
So we talked about these muscles down there. They do aid in sexual appreciation and, of course, orgasm, getting a hard-on, and ejaculation. Yeah. So if we can work on pelvic floor function to either strengthen these muscles and or downtrain and uptrain, right? And to create, giving you tips and tricks on how to sustain or, inhibit pre-ejaculation. It's more of a let's relax those muscles. And again, with premature ejaculation, it has been correlated with psychosexual. There's a psychosexual component as well.
Yes, of
so
course,
you want to make sure you're addressing the emotional and psychological aspect of those that are experiencing premature ejaculation. But literature has not been super strong with physical therapy or physiotherapy addressing men who have premature ejaculation, although there is literature to support it, not great in numbers though. Okay. So the sample sizes are small, the sample sizes that they test, our outcomes are small. So that's not to say that it's not a conservative treatment option, which I would definitely recommend first before trying any more invasive option that's out there.
Okay. Or would someone in that position find themselves popping Viagra or over-the-counter drugs? Is that anything you'd recommend?
So, it's your manhood. When it comes to Mr. B, it's your manhood. So I wouldn't be surprised if desperate times call for desperate measures. Sure. And especially if the options are not given to you offhand, they might think that's, they'll go to a practitioner and they'll, here, take this. Yeah. Well, it's not just a find it, fix it kind of thing, because now you've got, again, we talk about the whole person and looking at the whole person when you're treating them. to get the best outcome and not just masking it with a Band-Aid, because all those medications have side effects.
Exactly, it is a Band-Aid, isn't it? Yeah. Okay, what about the the likes of the Marathon Man, Magic Mike, or I've not even seen Magic Mike, so I don't know if I'm talking about the right guy here. But certainly Sting and the whole tantric. Is that related to the pelvic floor then? Sort of control for hours on end? Well, I don't know if it's hours on end, but for certainly longer than Mr. Bean anyway.
It's possible. Honestly, it is possible, and they do use tantric type of therapeutic approaches to premature ejaculation.
Okay.
So it's all about feeling the sensation and pleasure and having an erection. Now, it might not be super hard because you don't want to be there because you want to last longer.
Yeah.
So it's really a mental, I would say maybe 90% mental in terms of being mindful, practicing mindfulness, a form of meditation, and really being in tune with what you're feeling during the moment and being in control. And that takes practice, as you might guess. Yeah. That takes a lot of practice, a lot of control, but not impossible for sure. And I know a lot of the sexual therapists out there do work on things like this. So, do
you work alongside them often? Do you find yourself working alongside? Yeah.
Yes, we refer to each other, or again, not everyone needs, their relationship might be very strong and they're really good with their intimacy in other ways and they get support from one another. But oftentimes you get the opposite, where the partner doesn't understand and gets frustrated and or starts thinking that there's something wrong with them. So the whole relationship starts to kind of dwindle or get out of control, and they might not even know that's what might be causing it, because it may have started that way but unraveled.
Right. Okay, well, we've pretty much come to the end. Susie, I really appreciate your time. I can see your dog's wants a walk. Finally, top tips for everyday pelvic health. What are you going to tell the listeners, really?
Top tips for pelvic health. Definitely drink plenty of water. Make sure you're not constipated. If there's anything going on down there, know what your options are. Seek help, because we can definitely help. Have sex.
Yeah.
It's good. Having orgasms is great for your pelvic floor. And don't be shy to talk about your dangly bits or your vajayjays or your yoo-hoos, whatever you want to call it. Don't be shy. You're not alone, and we all have those burning desires and questions.
Brilliant. Oh, Susie, thank you so much. Look, how can people contact you? Any plans or time for online consultations? Do you do that?
I do.
So
yes, I do. Right now I'm moving to Asheville, North Carolina from Illinois, so there's a huge transition going on there. But I'm taking the practice virtual. I'm setting up my website to have the option of having consultations. And also a little, if they want a program to do hands-on work and guidance, of course, that would depend on your location. But no, I'm definitely open to consultations via email. I'm on Instagram. I'm also on Twitter. So I love hearing from people and what questions they have or concerns, because I oftentimes use those as fire for my blog posts.
Sure.
And I do the research and answer it there or on a live video or a vlog or something like that. So I love hearing from people and getting the word out there. That's all.
Oh, that's brilliant. Absolutely brilliant. Once again, Susie, thanks for your time. I'll include all the details in show notes of how to contact you, your Instagram link. They can get you on Twitter at Dr. Susie G. That's SUSIEG. Pretty much the same as Instagram, yeah?
Instagram, I think, has a dot in it, like Dr. Dot, because somebody took the other one. So it's got a Dr. Susie G. Yes.
I'll definitely put everything up. But at the very least, www.drsusieg.com. And
thank you so much. It's been an absolute pleasure, and you've been awesome.
I tried. Thanks again, Susie. Cheers. many thanks to my guest, and of course many thanks to you guys for listening in. Hope you enjoyed it. Don't forget to go to www.seannewton.co.uk for a full index of everything that we talked about in the podcast. Hope to speak to you again soon. Take care. Bye-bye.